Hi, everybody. Welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, Louisiana, and I've been partnering with COAST, or the Council on Aging in St. Tammany, for over 10 years. All of that time as the Caregiver Support Group Facilitator, and half of that time, so 5 years, as someone bringing you education, as I am right now, called Caregiver Coffee, in hopes to educate people on how to age well, on how to age in place in the setting that they prefer for as long as possible. And that often is at home, and to offer caregiving tips that will help everybody, because at some point we will need a caregiver, or we will be a caregiver ourselves if we're not a caregiver already. So today we're going to continue our discussion on Lewy body dementia. So this is part 2. You can go ahead and continue with this one, or you can go back and start over with look up Lewy body dementia part 1. So it's up to you. So today we're going to be exploring more of the resources on the website that is created created by the Lewy Body Dementia Association, which is a great website, tons of information. I covered some things in the first video, and we'll continue here about this very challenging condition. All right, so we're going to, and I will put the link to the website in the video description, as you know, as I always do. Before we get into more of Lewy body dementia, I always like to mention information about our caregiver support group, because we're always welcoming new members to that. However long they can join us, whether it's once a month or once every 3 months or anything like that. So I'm the facilitator. We meet on Tuesdays from 6 p.m. to 7:30 p.m. Central. Sometimes we're in person, sometimes we're Zoom. The basic pattern is this: the first Tuesday of the month, we're at the Slidell Activity Center. The second Tuesday of the month, we're on the Zoom platform, so you can join us using your computer, your smartphone, or your tablet, or you can even use a landline phone and call in like it's like a conference call. On the third Tuesday, we're at the Covington Senior Activity Center. And then on the fourth Tuesday of the month, we're back on Zoom. Now, sometimes there's a fifth Tuesday in the month, and sometimes we meet when we get the green light from COAST, and sometimes we just take that week off. And when we do meet, if we do meet on a fifth Tuesday, it's using the Zoom platform. And some information on where to find more about this. You can go to coastseniors.org. You can go to Caregiver Services, and then you'll go to, it's just a few clicks away. You'll see my picture, and there'll be a link to a PDF. That PDF is a flyer / calendar that we refresh every 2 months. So on that, it tells you exactly where we are during a certain week. With the address. If we're on Zoom, it will give you the Zoom link to click on, or the phone number to call. And I really do encourage the downloading of the flyer, because if a holiday like 4th of July or Christmas falls on a Tuesday, of course, we're not going to meet. But what we try to do is not cancel. We try to just move it somewhere else during the week, either before Tuesday or after, depending on where people might be celebrating the holiday. And of course, we don't meet on Fat Tuesday. So you can go to the website, get the flyer, and then the last thing I want to mention is that once you have the flyer, you'll have the ability to join the private email list for the caregiver support group. So this is not a general COAST list. This is just for the support group, and I use this to send out private emails to those who are interested in the group. And these are reminders on Tuesday morning. And it's also to get everybody a flyer when a new one is published every 2 months. Now, if there's a special video that I found that is especially good, or there's some kind of caregiver event, I will advertise there as well. But it's not a lot of emails that are being sent to you if you want to join that list. So thank you for listening to that. And let's get started with part 2 of Lewy body dementia. So the particular page that I chose here is the treatment page. And always like to always like to mention that not always, sometimes I remember to mention, so this is not to be considered medical advice. Even if I was a physician, which I'm not, you deserve one-on-one care for your unique situation. You are special, your loved one is special, and you're probably under the care of a doctor or medical professional right now, and it's important to get their specific advice for you or your loved one. Now, this information will still be valuable, I feel, because you can take this information, and if it's new to you, you can go to your provider with it and ask about certain things in a collaborative way. Medicine, the practice of medicine should be shared decision making, sharing information and things like that. So I encourage you to do that. Always bring them things that you're curious about. And you can count on this information because this is from the Lewy Body Dementia site. It's edited, it's reviewed by physicians in this field. So I feel that it's something that can be trusted. All right, so treatment options, Lewy body dementia, and sometimes I'll just say LBD, but that's what I'm referring to. So typically requires comprehensive treatment, meaning a team of physicians from different specialties who collaborate and provide treatment for each symptom that someone is experiencing as it worsens. This comprehensive treatment plan might involve medications, physical therapy, occupational therapy, speech therapy, and other types of therapy, and counseling. So we'll go through some of those things that I just mentioned. And I should mention on this particular website, some of these have links to PDFs that you can find even more detailed information that we don't have time for necessarily right now. So let me turn my timer off. All right, there are many treatments that can help with the symptoms. All medications prescribed for LBD are approved by the FDA to treat symptoms in other diseases, not particularly LBD. These medications can offer symptomatic benefits for cognitive, behavioral, sleep, mood, and behavioral changes in LBD. There are not any medications that will slow or stop the progression of LBD. And it is the same case for Alzheimer's disease and other types of dementia. Unfortunately, we don't have anything to stop or slow them down. It's symptom management. All right, so the next is treatment of the cognitive symptoms. Medications called cholinesterase inhibitors are considered the standard treatment for cognitive symptoms in Lewy body dementia. These medications were actually developed first for Alzheimer's disease. However, some researchers believe that people with LBD might be responsive to these medications, more responsive than those who are experiencing Alzheimer's disease. These drugs sometimes help to control behavioral expressions and hallucinations as well. Another medication that may be helpful is memantine, also known as Namenda. Movement symptoms are next. So treatment for movement symptoms, what is used to treat movement symptoms is carbidopa or levodopa. But if the symptoms are mild, it might be best to not treat them in order to avoid potential side effects. And that's a really good point because with medications, sometimes there's a side effect. So you have to really look at you weigh the benefits of it, potential benefits, and the costs, such as the side effects, having to take it, and paying for it, and other things like that. Visual hallucinations. Visual hallucinations. If the hallucinations are not disruptive, then they may not need to be treated. However, if they're frightening or they create challenging behavioral expressions, the doctor may recommend cholinesterase inhibitors for these. These are called, trying to see some of my pages cut off. Find where I was. In addition, newer atypical antipsychotic medications may be tried. Most Lewy body dementia experts prefer quetiapine or clozapine when the treatment is necessary for safety or quality of life concerns. And there's a newer medication that says pimavanserin was approved to treat psychosis and Parkinson's disease. Results from another clinical trial of this medication in people with dementia and psychosis are still pending. While traditional antipsychotic medications such as thorazine and haloperidol or commonly prescribed for Alzheimer's with disruptive behavioral expressions. These medications may cause severe side effects with those living with Lewy body dementia. And I did mention this in the first video when we're talking about sometimes people who have Parkinson's may not know that they have Parkinson's, they go to the emergency room for anxiety behavioral expressions, and they end up being prescribed this to calm them down, but then it has this, this really bad effect. So up to 50% of Lewy body dementia patients treated with an antipsychotic medication may have a severe reaction, such as worsening confusion, heavy sedation, increased or possibly irreversible Parkinsonism. So you want to avoid those at all costs. A REM sleep behavior disorder is the next symptom. And it says here that is quite responsive to treatment. So your physician may recommend a medication like melatonin or clonazepam. Some special treatment considerations are side effects. The following drugs may cause sedation or motor impairment or confusion. That's benzodiazepines, anticholinergics, older antidepressants, certain over-the-counter medications, including those that contain diphenhydramine and dimenhydrinate. Some medications, such as anticholinergics and others, may help relieve Parkinsonian symptoms, but they also might increase confusion, delusions, and hallucinations. So you really do have to consider what you're going to do there. Concerning surgery and anesthesia, be sure to meet with your anesthesiologist in advance of the surgery to discuss medication sensitivities and risks that are unique to Lewy body dementia. Persons with LBD often respond to certain anesthetics and surgery with acute states of confusion or delirium, and may have sudden or a significant drop in functional abilities, which may or may not be permanent. And there may be alternatives such as a spinal or regional block. These methods are likely to result in postoperative confusion, less likely to result in post-op confusion. And if you're told to stop taking all medications prior to surgery, make sure that you consult with your doctor to develop a plan for a careful withdrawal prior to surgery. So that's why you need to check all this stuff out well in advance. Other types of treatments include lifestyle treatments, including eating a healthy diet, exercising, and remaining socially active. Physical therapy, such as cardiovascular training, strength training, flexibility exercises, as well as gait training or walking training. Speech therapy may improve low voice volume, poor enunciation, muscular strength, and swallowing difficulties. Occupational therapy helps maintain skills and promote functional ability and independence. Music and aromatherapy may reduce anxiety and improve mood. Individual and family psychotherapy may be useful in learning the strategies to maintain emotional and behavioral symptoms and to help make plans that address individual and family concerns. And of course, support groups. Here's another one for support groups may be helpful for caregivers of persons living with Lewy body dementia to identify practical solutions day-to-day frustrations and obtain emotional support from others. And let's see, there was a second piece I wanted to mention in this video. It has to do with advice to persons living with Lewy body. Here we go. So advice for people living with Lewy body dementia. Coping with the diagnosis of Lewy body dementia and all that follows is very challenging. Getting support from family, friends, and professionals is critical to ensuring the best quality of life. Creating a safe environment and preparing for the future is important too. Take time to focus on your strengths, to enjoy every day, to make the most of your time with your family and friends. And here are some ways to live with Lewy body dementia day to day. And here are I'll give you the overall headings and then come back and add a little bit of detail. The first one is to get help. The next one is to consider safety. Number 3 is to plan for your future. And the fourth one is to find enjoyment every day. In getting help, your family and close friends are likely aware of the changes in your thinking, movement, and your behavior. You may want to tell others about your diagnosis so they can understand better the reasons for these symptoms and behavioral expressions. For example, you might say that you've been diagnosed with a brain disorder called Lewy body dementia, which can affect thinking, movement, and behavior. And as the disease progresses, you'll likely have more trouble managing everyday tasks such as taking medication, paying bills, and driving. And you'll gradually need more assistance from family members, from friends, and even professional caregivers. Although you may feel reluctant to accept help, try to let others partner with you so you can manage responsibilities together. And I think that is the key, the partnering aspect of it. And that's for anybody who's living with this disease or another type of dementia, or you're a caregiver. It's because a lot of people are reluctant to receive help, and they don't want to feel like they're a burden to others. Consider safety. There is a link here for what they call a Lewy body dementia medical alert wallet card. So you can fill this out, put it in your wallet. So if there's some kind of emergency and there's a loved one not around to explain that you have Lewy body dementia, then hopefully they will find that in your wallet. And then they suggest consider subscribing to a medical alert service that provides a bracelet or a necklace with access to 911, or to that someone could share the information with 911. Address safety issues in your home, including areas of fall risk, poor lighting, stairs, cluttered walkways, etc. And actually, we'll be doing some videos on falls and preventing falls. Talk with your doctor about driving and having your driving skills evaluated if needed. Plan for your future. There are many ways to plan ahead. If you're working, consult with a legal and financial expert about planning for disability leave or retirement. The symptoms can interfere with work performance over time. It's essential that you plan ahead for that situation. And some people, they discern, I'm going to tell my employer. Some discern, I'm not going to tell my employer. So it really varies, and I think it varies with the type of employment that you're in. If there's some safety considerations, if you're responsible for things that might impact safety. So, but that is just something to consider and pray and discern about. Consult with an attorney that specializes in elder law and estate planning. Identify local resources in the area, like the Council on Aging in St. Tammany, all the things that they offer, as well as businesses, what they might offer. And explore moving to a retirement home or a continuing care retirement community where activities in varying levels can be provided over time as needed. So as the condition progresses, would you be able to stay there and just kind of move to a different place in that area? And lastly, find enjoyment in every day. It's important to focus on living. Your attitude can help you find enjoyment in daily life. Despite the many challenges and adjustments, you can have times of humor, tenderness, and gratitude with the people closest to you. So that is a great way to end that right there. So I hope this was helpful to you, these two sections, the treatments and then the advice for people who are living with Lewy body dementia. In reading this, my sense is that those who are living with the disease also help to write that. Like, I don't think it's experts. It's not medical experts telling those who are living with the disease on how to live, and here's some advice. My sense is that those who experience it and who are caregivers also contributed to this. So all right, well, we will end there. So excuse me, I hope that you enjoyed the second installment on Lewy body dementia. There's so much more at this association's website to explore. I hope that you will click on the link in the description and find more information if you're curious about Lewy body dementia, or if you are experiencing it in your family, and this will have many, many great resources for you as you are on this journey. So thanks again for watching this. Thank you for supporting the Council on Aging at St. Tammany, and I hope that you are able to join us for more Caregiver Coffees in the future.